Yeah.
Every day when he gets home, SAUL SAKUDYA inhales steam with some eucalyptus oil added to it. He says this helps reduce the mucus in his lungs. He believes coughing gets rid of germs that could make him sick. With no word from Zimbabwe's government on when vaccines against COVID-19 will arrive, the businessman hopes alternative therapies will protect him.
Yes, I heard doctors saying steaming is not good, even home remedies are not good, but I think it's up to you to see whether you can use it or you cannot use it. But for me, it helps me a lot.
Zimbabwe is battling a second wave of coronavirus infections, and the already struggling healthcare sector is overwhelmed. Some of those buried recently include 2 cabinet ministers, a retired general, and other high-profile Zimbabweans. The country of about 15 million people has 84 working ventilators in public hospitals and just over 1,000 beds for COVID-19 patients in private and public institutions. That's according to the Health Ministry. Public healthcare workers often go on strike, protesting against poor salaries and the lack of personal protective equipment and drugs.
Sometimes you find patients dying in front of you when you know what were you supposed to do, but you don't have any choice. There is no the resources. You know this patient needs a ventilator, but there are no ventilators. You really know these patients need certain drugs, but you don't have.
To try and bring down the infection rate, the government has extended a lockdown by 2 more weeks. This includes a dusk-to-dawn curfew and shutting land borders. Non-essential businesses will remain closed until mid-February. That includes clothes stores and mobile phone repair shops. Only 10% of government workers are allowed to work from their offices. The rest are at home. Health officials are investigating whether a more infectious South African variant of the virus is circulating in Zimbabwe, fearing it may have entered when thousands of citizens living in South Africa returned home for the December holiday. The World Health Organization says the South African variant has so far been reported in 5 other African countries: Botswana, Zambia, Malawi, the Gambia, and Kenya. And according to WHO, new and more contagious variants of COVID-19 are spreading across Africa, causing an increase in infections and deaths. SAUL SAKUDYA tested positive for COVID last year.
This is Zimbabwe.
He says he survived despite getting little help from hospitals. Since then, he's been using herbal home remedies to try and boost his immune system, doing everything he can not to get sick again. Haru, Mutasa, Jazeera, Harare.